Now, we understand all too well the connection between housing and healthcare. If people are not on their medications, they will eventually lose their housing, and we will see more people sleeping outside. That is a guarantee. Now, for 35 years, under both Republican and Democratic leadership, through past economic recessions and deep budget deficits, we have continued to invest in the basic health care of Minnesotans' poorest and sickest citizens. We've committed to this because long ago, we decided that it was both fiscally wise and the right thing to do. To the senators on this committee, we ask for your leadership. You are the last line of defense for the 70,000 people who have so very, very little. Please help protect the basic dignity and care that is afforded to them by General Assistance Medical Care. Thank you for the opportunity.
My name is Freddy Toran. I receive coverage through GA Assisted Medical Care. I currently suffer from glaucoma, rheumatoid arthritis, and high blood pressure. I take medicine for my eyes twice a day, and if I do not have it, my doctor informed me that my eyesight will worsen. Eventually, I will go blind. I first applied for Social Security disability back in 2004, and my arthritis has been so disabled that my legs would lock up and make me unable to move about or work, as is often the case. I was denied Social Security benefit and replied 2009 and hope to have a positive outcome with the assistance of the state funding program to help people on general assistance through the process of attaining Social Security. I was living on general assistance for $203 a month, plus odd jobs and sharing an apartment for $475 a month until last month, when the landlord went into foreclosure. I'm currently living in a shelter trying to find affordable housing. I'm trying to do odd jobs, but my arthritis and eyesight limit what I can do. I have volunteered at Central Lutheran Church and St. Stephen's Human Service for many years. And GAMC is a critical bridge for me to not become blind or more disabled until I attain federal health care. I hope you find a way to help, because we cannot afford to pay more than we do, and this can be difficult for us. Thank you for listening to me.
My name is Gary Gunkel, and I appreciate you for listening to why I am asked you for your support of this legislation, preserving health coverage for people like me. I was born in a small town of Wadena, Minnesota, and eventually moved from the farm to South St. Paul. After high school, I had a low draft number for Vietnam, so I asked if I enlisted if I could spend the summer working at my grandparents' farm. I then went to Fort Sam Houston, where I became a rifle expert and a medic. I was in an ambulance company of the 7th Brigade, which was a medical unit, where we learned a lot of things. One simple thing that I was taught, that an ink pen is a mighty powerful weapon. It can be your worst best friend or your enemy's worst nightmare. We could use it as a weapon, or splice an artery, or perform a tracheotomy. I was told that a medic was a prize catch because the Vietnamese could use you to work on their guys at the expense of our soldiers. And if you ever saw the movie MASH, those were the type of ambulances that we drove back then. In later years, I did some farming, worked at the VA hospital for 7 years, and I managed in restaurants for 15. In August of 2008, I was living in Inver Grove Heights, heading for work at Mystic Lake, where I had worked security for 9 years. A deer entered the road on 35E, resulting in an accident of my SUV, caused back injury and headaches. I lost my job 2008, a fall. I began using GAMC in October of 2008 to address my injuries. This was a godsend, as I was waiting for veterans benefits to kick in. I was sharing an apartment at this time and rent with my son. Till last year, my son was laid off as a cook and entered the military full time. When he left, I couldn't afford the rent, and I lost my housing. I lived with friends for a few months, and I lived at Harbor Lights, but I have not had stable housing for almost a year. I am hoping to get housing through the VA but that hasn't happened yet. For some vets, GAMC is a bridge until federal assistance can go into effect, but that can take for a long time. I'm representing other vets who need this bill passed to allow access when it is needed most. I made not just one sacrifice vulnerable by serving our country. I've made two. See, this week, my son has left for Afghanistan in the 101st Air Division. Thank you for sacrifices that has been made to protect our vulnerable. Thank you, Mr. Chairman.